Hello, everybody. This is episode 82 of our podcast, Artificial Intelligence and Cybersurgery. I'm Andrew Gums, here with my co-host, Dr. Vincent Grasso, Professor Vincent Grasso, also. Um, this is the official podcast of our journal, Artificial Intelligence Surgery, which is the first journal, maybe the only journal dedicated exclusively to AI and surgery. And it's also the podcast of our society, Artificial Intelligence Organization for the Next Generation of Surgeons, AONS. So, Vincent, with that, I'll let you introduce our next guest.
Thank you. It's a great pleasure. This is episode 82, Andrew. We're closing in on 100.
Yeah.
So it's getting excited, and we have the pleasure of having Marcello Di Martino on. He's an MD PhD, very well trained guy in Italy. He's a hepatobiliary pancreatic surgeon. He's working at the University del Piemonte and Orientale in the north of Italy, and it's a great pleasure to have you on and learn about what you're doing in your hospital and in your surgery and some of the exciting work that you're doing. So welcome, Marcello, to our podcast.
So, Marcello, so you should be warned. Both Vincent and I speak Italian. So, if you want to say anything, I know your English is excellent, but if you ever want to throw anything in Italian, feel free to do so. And the main reason I'm telling you that is I want to know in Italy where you're from. To start it off, where were you born?
So, so hello everyone, and thank you for the opportunity to be here. It's such a pleasure. And so, about me, I'm from the south of Italy, exactly near Naples, which is the very south of Italy. And then I worked around so in a few places, and then I ended up coming back to Italy, basically, but in the north now.
You're the only place I know next to Naples is Caserta. Are you next to Caserta or
No, more like more
Salerno?
on the coast. No,
Ah,
more on the coast. Yeah, between Naples and Salerno. Yeah, the
so
Amalfi Coast and these kind of
I
things,
was
which is
about to
quite
say.
nice place, if I have to be
Oh,
honest.
so
Oh
so,
yeah, yeah.
so you're next to Amalfi?
Yeah, kind of more so random, but yeah, that's the place. That's the place.
Yeah, yeah, beautiful.
And then
I haven't been there since I was a kid, but definitely one of the most beautiful places I've ever seen in my life.
yeah,
Beautiful,
it's
beautiful.
nice. It's nice.
Where did you do medical school? Was it at Naples or
So yeah, I did med school in Naples,
yeah.
but then I didn't do my training in Italy.
Ah,
I decided to leave after med school just after that. So I did my training in Spain, in Madrid, exactly.
interesting.
So that's become home for about 5 years. And that was a very good moment, intense, very intense, but
Do you speak
uh,
Italian, Spanish, English, anything else?
no, so far.
That's enough. That's enough.
Napolitan's a bit, which
Yeah,
is like the local language from my area. But yeah, I mean,
yeah.
yeah. So Spain became home. That was a very good part of my life and a very good training.
So
Then I
so
moved to
so
the
this
UK.
this
Yeah.
this is a bit of a hot topic, um, in the sense that you know it's very difficult to work in Italy. Let's I'll just phrase it that way, and you don't have to comment on that. But I do want to know, why did you choose Spain? Was it because you already spoke English? Did you know what I'm trying to
Yeah,
get
yeah, yeah.
is I would
So, I
like
mean,
our like listeners to know from Italy, why it was a good idea for you to, why you felt it was a good idea to go to Spain. I can think of a million reasons, but I want to hear from you why you decided to do that.
so, I mean, mm, so that was kind of a personal reason as well. And so I did want to have an experience abroad, which ended up to be a quite long experience, more than 10 years.
Yeah.
And so why Spain? There is, I mean, I've been asked this many, many times. So there is no an exact reason for that. Uh, I had a few friends living there. I didn't speak Spanish by that time,
Okay.
but I had a few friends living there and I knew the process. It was a national exam. based just on your skills. So there was a ranking from 1 to 15,000. According to
was
that,
the
you could
exam
choose your
in Spanish or in what
written
language?
in Spanish, everything in Spanish.
Okay.
Yeah. That was challenging, but it was fine. And so it was based on your skills, based on the level you had, and you could pick up the place you deserved. So I did this big exam, went well, and I got my training place in Madrid.
Nice, nice. And then after Madrid, where did you go back to Italy then, or did you go somewhere else?
No, I went to the UK, to the US and the UK. US for a very short time. UK was a clinical fellowship, and so I started to be dedicated to the HPB field by that time. So I went to the Royal Free, which is one of the two HPB and, well, biggest, I would say, HPB and liver transplant unit in the UK, London, with King's. So I did my clinical fellowship.
Where were
And that
you in America? Where were you?
in America, spent some time at Mayo, Florida, Jacksonville, but
Oh,
that was
nice.
just 2 months.
What was that? Was Horatio Asbin there?
Yeah.
Oh, nice, nice. Good, good.
That's
Great. Yeah.
that's when all the minimal invasive things started. But yeah, and I mean the British experience, despite being a while ago, that was probably something that really marked my work trajectory and experiences because you get to connect with many people, uh, which was good. And then I went back to Spain, to my original place
Yeah.
in Madrid, same hospital, where I spent four more years. And that probably was the best part of my working experience. That was really nice.
Yeah.
Being junior, but with a consultant job, with many opportunities, that was good. I did enjoy that part of life.
And now, are you more of a
Then I
cancer surgeon or more of a transplant surgeon?
no, then I went back to Italy. That COVID came,
Mm,
decision or in life, decided to go back to Italy. I spent a couple of years in Naples, where I am from, in a transplant unit. So that was from shifting from HPB more to a liver transplant.
yeah.
And then there was this opportunity for a more academic job in the north of Italy, which is where I am now, which is Novara, which is not a
Not
huge,
far from
not a
Milan. Yeah,
big city in Italy, but it's an academic job, and I'm very happy to be here.
about how far is Novara from Milan? It's 30 minutes, something like that.
Uh, 35, 40 minutes. It's less than 50 kilometers. Yeah,
It's
but very
between
close.
it's between Malpensa and Milan, right? Or
Yes, correct,
and
correct.
and and do people still call it Malpensa? I don't want to call it the other name.
It's as far as I know, is
Okay.
Malpensa. Yes,
Okay,
yes,
okay.
for
I
sure.
thought I thought it got renamed. And so I think you're older than you look, Marcello, from all of your experience. You look like you look like a little baby, we would say, but it sounds like
No, I'm not. Yeah, I know I'm not a baby anymore,
uh,
but
yeah,
yeah, not a baby anymore.
nice,
No.
nice.
Not
And
too
so
young. Not too young.
you have been working very closely with the IHPBA. What is your role? How long have you been working with the IHPBA? And do you also work with the EAHPBA, I presume, or more with the IHPBA?
So now it's more with the IHPBA because I mean I was working with the EAHPBA, but then I kind of quit for a while because I became the chair of the early career group of the IHPBA, and I couldn't handle too many things at the same time, so I prefer to do one thing but nicely
Yeah,
done instead of
right.
doing too many things but not too well.
Hmm.
So I say to the EHPBA people, sorry about this, but I cannot handle all of these things. So this started when I was in Spain, because I was quite involved with the Spanish Surgical Association. And then basically just sending my CV, I started to be involved with the EAHPBA first, being Spain, and then with the IHPBA. And then there was this group which was born in 2020. It was a very initial project, like to give space and promote initiative for from younger surgeons. And there have been so far like two terms. The first chair coordinator, call it as you want, was Julie Allen from Canada. Very talented surgeons and extremely skilled in organizing and giving a vision to this project. And now it's me, but this is going to end in Singapore, which is in a few months, and this will kind of continue. That's been good. That's been good, like having the opportunity to, I mean, see different things, different realities, connect with so many people, and understanding many points of view. I mean, me having been worked in three countries so far and connecting with so many people is it's something that give you kind of plus for
Yeah.
understanding reality, I'd say.
Yeah, no, I can relate to that. It's fascinating to see
Yeah.
how healthcare is delivered, how surgical teams are run, how patients interact. It's all fascinating how different it is depending on where you are, what country, and also what setting you're in. So now, are you transplant? Are you?
HPB and a bit of surgical oncology and general, I'd say. Yeah.
Yeah, yeah,
This is
very
not the
good.
biggest hospital in Italy, but there's an HPB program and a general surgery and surgical oncology program
No,
with some space dedicated to research,
it's
which
a
is
well, so
something
it's a
I,
it's
I
a, it's a
enjoy.
very well-known hospital. I think, come to think of it, what's the name of the head of intensive care unit? Do you know the name, the
Here,
last name?
it
Yeah.
just it's here it just changed like a couple of months ago. There
Ah,
was one before, Della Corte was his name, but now
ah.
it just changed like a few months ago.
Is there
If
a
it's fine.
doctor with the last name of Caldara that works there? Or you might be at a different hospital then. That must be a different
No, I don't
hospital I'm
think so.
thinking of. Okay, okay. So what the IHPBA, do you know a little bit of what their policy on AI adoption is, on education? Do you have any insights to, or even like what you're interested in regarding maybe augmented reality or 3D imaging or I can never say this word, volume studies, three-dimensional volume studies with the liver. Like what kind of interests you the most right now about now that we're in the era of AI surgery? What excites you the most? Is it maybe even interacting with patients through communicomics? What is it?
So, I mean, IHPBA wise, not sure if there is a real policy. I know that will be like some new things coming up in Singapore, being the next Congress in Asia, and being Asians very like
Yeah.
on top of this. So we'll see quite a few nice things. Personally, um, so I would not define myself an AI people or an AI expert, an enthusiast about this, but not an expert, fair to be honest. And I do try to use tools mainly for support for clinical tasks and research tasks. So what I do see there could be some future is on, so, I mean, all of these things, I mean, AI is very helpful in merging one of the tools in merging data and with the generative AI giving support. So for personalized care and for clinician or research support, I do think it could be very useful. Well, very early stage, as you know, and you could teach to all of us.
Yeah, you
But
know
yeah,
what I wanted to get a little bit further in is I just saw
yeah.
this study, and Vincent, you can comment on this, that looked, I think it was published in the Guardian, and it at least it was the story I read was in the Guardian. I'm not sure if it was referring to a paper that was published in a medical journal, but looked at ChatGPT like grossly underestimated an emergency and when people should go to the emergency room, based on prompts and what have you. Like Vincent, what do you think are some of the risks of people at home using ChatGPT, for diagnoses? I mean, I think it's wonderful, like what Marcello does. I use it all the time when I'm dealing with my patients. If I want to check on something or even think about the latest therapies that we can give them. But what are the dangers of like patients using, something like ChatGPT to really give themselves healthcare?
It's funny, the I read a study as well. There's people that are using ChatGPT and they use do-it-yourself videos on YouTube, and they kind of learn how to do things that are complicated, like home improvements, electrical work. They
Plumbing, yeah.
they kind of fool around, and when something's really easy, there's no problem. But if there's something a little tricky, like they have a big problem because they don't really know what they're putting in. They kind of speaking at a high level. Much more dangerous in a clinical situation where the healthcare is so nuanced that unless you really put the correct prompt in, which you have to have a lot of domain expertise as a clinician, you miss all the subtle things, the subjective things about pain and duration and things that we know. So they run a lot of risk, and when something's not serious, no foul, no harm, no foul. But very quickly it becomes a problem, and it's very hard to regulate. It's hard, and people aren't formally trained in prompt engineering. They don't really know any of that stuff. So it's kind of the Wild West for how people engage in large language models, and they then take the risk, the high risk of being told this is not serious, it's not a problem, when in fact it is. And
It's a little bit,
not a
it's
problem.
scary because,
That's scary.
ChatGPT and all these, a lot of these programs, they're kind of like the ultimate yes man in the sense that they want you to be happy and they want to give you what you say you're looking for. You can
Right.
imagine say like, "Hey, ChatGPT, my right arm hurts, but I don't think it's anything. I'm healthy. I'm this. I'm that, or whatever." You could almost imagine ChatGPT almost being tricked into be like,
Sure.
oh, maybe it is you were lifting weights yesterday. It's probably nothing. I mean, and again, I don't know, but that was kind of the point of this paper, which really makes you wonder whether, only certain people should have access to these things, at least when it's talking about healthcare. You know, I don't know the right answer. Vincent, also, I
Yeah.
know you have an opinion about how do you communicate with patients, like based on ethos, pathos, their education level. But what do you think, for someone like Marcello, how should there be a special ChatGPT for doctors?
Well, it's a good point. Where we were called in the old days power users when you used a GUI and it was complicated. We were power users because we're domain experts, and they haven't yet created separate domains for these large language models for people like us that would require a lot more input before it would give you an output. And the example you mentioned, I have a little pain in my leg hurts a little, it's a little swollen, and I don't think it's a problem. So ChatGPT says, well, maybe you should elevate your leg, maybe you should put some ice on it. But you forgot to say that you just flew 15 hours on a plane and you're on blood thinners and you didn't take them for 3 days. So now you probably have a blood clot in your leg, a DVT. You didn't give it the information. So, for somebody obviously of Marcello's level, he can get a lot out of a large language model with just a little prompt engineering expertise, which is just the formality of how you ask it questions and engage, which you really should do before you start fooling around and trying to get answers out of it. And
Like Marcello, are there any
Yeah.
any applications
So,
to help
so
you
I can tell
to?
you,
Oh, go ahead.
I
Sorry.
can tell you mine on this
Yeah.
because we, with some colleagues and friends, we somehow try to kind of properly assess this. So we had this paper published on Annals a couple of years ago about like having some bundles for acute pancreatitis. Creating the bundles by ourselves and with ChatGPT. And now we have under review a kind of a systematic review done by us and done by ChatGPT doing the same thing. So having done it, so I fully agree with what you say. ChatGPT and similar application can do it. They will do it in a nice way, providing you a nice result. But I mean, the problem is in the details, which are not
Yeah.
yet good enough. And I don't think it's reliable enough for completely trusting them at the moment. So it's a support. It can be used for like taking you some work off, but I would not trust these or similar things I mean, for a cooking recipe, yes. For a research paper, no, no.
It is
For giving like,
unbelievable. Have you had experience with when ChatGPT just hallucinates and just makes up
yeah,
citations? It is
yeah,
it's
yeah,
incredible. You know, you have
yeah,
to
yeah.
you have to spend more time figuring out what is fake than
Yeah,
just
there are
doing
many,
the
many fake
paper.
things. Many,
Yeah.
many.
And but
Yeah.
it's so nefarious because it's like it's almost a citation, so how can a layperson realize you can imagine them like give me this answer of my loved one who's sick with this cancer and give me references and then boom 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 all these fake references and these people come to doctors and like hey this is what ChatGPT says and, the doctor doesn't have time to check the references it's
90% of them are not real. 90% of them say for references.
yeah,
It's good for someone like me for like proofreading or like grammar review. For that is
exactly.
quite good. For
Exactly.
not a native speaker, yeah, that's good news.
I'll actually get a little bit upset at ChatGPT. I'll be like, ChatGPT, why did you make this fake reference? And then it's like, sometimes it's like, sorry, what the hell? There's another story I like to also talk about. This woman in China, I think it was a reporter from a journal was visiting his mother, talking to his mother on the phone or something, and she was talking about how she wasn't able to see a doctor for months, and when she finally does get to see the doctor after traveling for an hour and a half to see the doctor and waiting for another 2 hours, the doctor gives her 5 minutes, is very rushed and stressed, and then sees the next patient. So now she likes to talk with a large language model and she actually says how the human doctor is robotic but the program the AI is not it doesn't rush me, it answers all my questions, and this is also what is terrifying of of uh, of what's happening, because people aren't realizing that the information they're getting is oftentimes questionable. You know. So, Marcello, what other things do you look for in your field? I am very interested in looking at like surgical multiomics, uh,
Yeah, no.
so we can predict we can stop guessing with cancer patients. But what I'm also curious about now, I've recently become curious, is what about using these omics to for transplants, so we can guess better pre-transplant who should get what organ. Do you know of any research of looking at radiomics with this, or maybe even looking at pathomics with this? I know they do spatial transcriptomics, but we don't have time to get into the details of that. But do you know of any AI that is being used to help people with don't with organ allocation?
Oh yeah, there are some of them. So especially one from Barcelona in Spain. There is this hospital Vallebron developing an app that they use like taking pictures to evaluate the quality of liver to estimate the percentage of fatty liver or how good the liver is
So of
and
the actual
estimate
organ,
if
the actual
yeah,
organ, or yeah, okay,
the actual organ when you are doing the retrieval. Well, taking a picture, you can try and kind of guess instead of having a biopsy, sending him to the pathologist and say, is this good enough or not? Fatty tissue, fibrosis, etc.,
yeah,
estimating it by picture.
yeah,
And then this is what transplant wise, liver wise, well, I mean, preoperative planning, it's something that we do care about a lot. So right now, well, there are plenty of reconstruction, merging like images with function. That would be surely a very interesting topic for future development and intraoperative navigation. But well, in Europe, we are quite far away from them. There are like many nice videos and publication from many Asian or American groups, but mostly Asian. In Europe, this is quite like, I mean, at least in my experience, far away. That could be extremely interesting, like merging the images, the anatomy, biology, and with intraoperative. It would be like kind of dream. But I mean, yeah,
Well,
that could be
I
an
love
option.
the ease of that. Just like you say, we all have smartphones. We can all, we can all take a picture. It's very practical. I love also a solution that is realistic with the limitations that we all have. You poor guys, you have to jump on a plane sometimes, fly somewhere, do an explant, come back, implant it. You can't be expected to also gather all of this information, upload a CT scan, have the CT scan, someone look at the radiomics or what have you. So I
But
love the ease
this
of that solution that you
this
described.
could be too. Like there is this like quite enthusiastic field about classifications of let's go back to pancreatic cancer with the ABC classification, anatomical, biological, and conditional, etc., etc.
Yeah.
And well, which is anatomy, biology, and patient condition, which is like roughly so far, you do not have a precise estimate. This is for defining that yes, neoadjuvant, etc., etc. But merging this information, like with the linear scale, to understand the risk of patients if doing or not a procedure, if doing this or well, this could be how the omics could give a support, integrating mutational status, etc., etc. Probably this is the future, but I think we are quite far away from that.
So so you came back to, have you always been academics your whole career, or did you do a little private
Yeah,
practice?
no, no, never practiced, never private. But I started being more clinical, and I got like fascinated by these things because of my old Spanish boss. She was very much into this, and
You had
she,
I hate that this is a cause of surprise to me, but unfortunately it still is, and I'm happy about it. Was your boss a woman?
oh yeah.
That is fantastic. Oh, what a dream that must have been. That is
Yeah,
that's great.
and
Yeah.
she has been the first like leader of the Surgical Spanish Society. She was a very strong woman with a very big personality,
Yeah.
and I surely owe her many things. So
That's
I do
great.
remember her with much appreciation. Yeah,
Oh, that's great. I am
I grew in this kind of environment. Yeah, yeah,
Yeah, that's fantastic. One of our official partners is Women in Surgery Italia, and
yeah. I know.
I'm so happy to have more women in the surgical field. Honestly, Vincent, we don't even talk enough about that. We should toot our horn a little bit more. That we have them as our official partners. It's been great working with them, and it's better for everybody. You know, uh, Other surgeons, but also for patients.
So yeah,
So.
in the unit, in the HPB unit, when I was in Spain, I was the only male surgeon. There were kind of females
Yeah,
at
yeah,
some
yeah.
point, at some point, at some point.
Now I know why you went to Spain. Finally, the truth comes out. Yeah, yeah.
Well, this started after a while, but yeah, I mean, no, it was very enjoyable. I must say, I must have, it was, I mean, it was nice.
Yeah, yeah, no, that's very cool. So Vincent, I'm gonna let you close us out a little bit here. Do you have any last parting thoughts? Any things that Marcello brought up that you want to touch upon?
We're working on those book chapters with Isabella. And
Yeah.
my chapter is on leveraging enhanced communication in the pre-op and post-op experience for HPB surgery. So maybe we can follow up with Marcello on some of that,
Yeah,
how the intraoperative experience is in the hands of the surgeon and the technology, right? And you guys are really well trained. but getting somebody optimized before they hit the operating room and when they're discharged on those 30 60 days out, you're out of the hands of the surgeon literally, and you're at the mercy of the health system that's taking care of you. So you can have a world-class surgeon in the OR, and the post-operative machinery of the health system maybe isn't so great for a lot of other reasons. So we want to be able to try to enhance the preoperative optimization, the postoperative optimization, and then within those 90 days have a better outcome. And I think that there's room for that in our work and communication enhancements and AI and all those kind of things. So maybe Marcello, we can have another discussion with you and bring you up to
Oh,
speed
yes,
on that research. It's very exciting that Andrew and I are
absolutely.
involved in.
Yeah,
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 actually, it sounds like his center might be a good center to send out some of some of the documents that you've
Oh,
had
yeah.
in review. Yeah,
Okay.
great.
Well,
Well, Marcello, thank you so much.